I'm Lucy Brown. Thank you so much for the opportunity to share some projects that I've worked on in a previous role, but also working directly with the Centre for Sustainable Healthcare, obviously where I work now, because it means so much to me that it probably speaks volumes. So I was involved in a project when I worked at the Florence Nightingale Foundation, which partnered with Nuffield Health. And we were really, really proud of how nurses got involved from the front line in making small incremental changes to practice that would impact enormously on the way that we deliver sustainable healthcare. So this is our project. We're very proud that we managed to present to the International Congress of Nursing last year to share the findings and really encourage nurses and midwives to get involved in sustainability and really raise the agenda. I recognise my bias, but I think nurses could really be key in leading the changes in healthcare that we need to see to help protect our beautiful planet. So as it said, it was linked to achieving the Sustainable Development Goals from the UN and really looking at empowering nurses and midwives with the help of the Centre for Sustainable Healthcare and SusQI methodology. Now, the project was 18 nurses, frontline nurses, band 5 and 6, from across the independent sector and some from the NHS as well. And the idea is that they had small project ideas that they could make changes at ward level or clinic level. Over 6 months was their project time, and so just small changes they measured. I've listed some of the projects there. They were absolutely amazing. I've pulled 3 out that we can go through in a bit more detail, but mindful of time, so welcome to take any questions or queries later if you're interested. So the idea was really to empower nurses to demonstrate that they are leaders. So we empowered them through a number of interventions, working with the King's Fund, RADA, the Royal Academy for Dramatic Arts, really empowering their voice and speaking and sharing their ideas. And I guess my call to action from all the nurses and midwives on this call is to have your voice heard. If you will have brilliant ideas that you can look at changing practice. So make sure that people listen, because now is the time for you to raise your voice and be heard. So it was really about empowering them to take projects forward. With the Centre for Sustainable Healthcare, we gave them the methodology, so Sustainable QI, using PDSA cycles, to really look at how they could bring those projects to life and really make changes. And I'll be honest, it was a pilot programme. We were absolutely astonished by the results. So as you can see here, 18 nurses completed the programme. It was a pilot programme. And between them collectively managed to save 6,281 tonnes of carbon through small incremental changes to practice, whether that be through removal of paper couch covers in examination room, cessation of single-use equipment in ophthalmology. The list is there, looking at paperless options through digitalisation of patient records. So all of these amazing things here that are listed there, looking at greener endoscopy as well, and the removal of using penthrox as an anesthetic gas as well. So really, really good projects there. But I think what blew us away is that actually if you give the frontline a voice and you listen and allow them to share their ideas and implement their ideas into practice, you will only reap the benefits. And empowering them and getting them to believe in themselves is half the battle. I guess the main points I wanted to make was actually, just go back a bit, is that through small incremental changes, you can really make a massive, massive impact. And imagine about scaling these projects up across all countries globally so that everyone can impact. And I think the key thing here is it's about collaboration, not competition. How can we all work together for the greater good? So I've got some examples of the projects. I will do a whistle-stop tour, mindful of time. But this is Brittany Bowen. She's a clinical lead for cardiology at the UNs Health Group, and she questioned. Now, I think many of us have sat opened up a dressing pack or a theatre pack. We don't always use all the equipment that's in there. We always throw away that one syringe that's never even used. We don't use all the gauze. So she questioned that. She's worked in cardiac cath labs, and within those preset theatre packs, there were about 30 pieces of equipment, and only 8 of them were ever used in most of the procedures. So Brittany, feeling empowered and feeling full of confidence, went and spoke directly to the manufacturer, national manufacturer, to look at how they pulled together the theatre packs, and they welcomed her insights as a user of their products, and actually together they worked together to reduce the packs. Now, not only did they reduce making the equipment, throwing away unnecessary equipment, incineration of unnecessary waste, but also the transport costs. So it had an enormous impact and has very successfully been achieved across all of the sites. So she's had small changes to practice have actually escalated across all of the national sites and all the packs for theatre. Something as simple as just questioning why which I think we all do through evidence-based practice anyway. So next, and I can introduce you and share more details as well because I'm mindful of time. Next, we have the amazing Rachel Brown, who went on to become a Florence Nightingale Scholar through this project. Very simple project, but through scaled up across clinics, across outpatient departments, across all of the areas. Rachel looked at removing those lovely blue couch covers. I know Rachel jokes when you speak to her, said, I never thought I'd be talking about couch covers quite so much, but it's had an enormous impact and been taken on nationally by the Royal College of Nursing and across NHS trusts as well. So it's absolutely amazing. So it's just actually thinking, why are we using the paper couch cover when actually we have to wipe it over in between patients anyway for IPs, for infection prevention and control purposes. So a really great project, which you can see can scale up enormously, and demonstrated there is, the low carbon care is low cost care too. And finally, this is a new project by the Dr. Susie Moody, who's a frontline nurse, but also a biochemist by background. And she wanted to look at the way that we utilise food. Really simple projects, I won't go through to all of them in detail, but really looking at the placement of food choices on a menu to encourage more patients to go for plant-first diets, and actually looking at reducing the number of red meat on the diets within a hospital, and that's at Southampton NHS Trust. She also looked at something so simple that is such a big impact, is with hospitals, they order navel oranges, the big large ones. They're quite tricky to peel, particularly if you're not very well. And she went to move to the easy peel option, and that saved quite a lot of carbon emissions, really, because people are actually eating, and they can peel the orange themselves, eat it, so they're getting that lovely nutrition and vitamin C, but also we're not seeing any food waste as well, which is brilliant. Such a simple thing. So it's just getting you to think and question, why am I doing something? The basis of all of our practice, really, but then having that confidence to speak up and share it. And I guess that's what I want you to take away from today. One final comment from me, Kath, just mindful of time, is there are 28 million nurses in the world. I recognise my bias. We are the most trusted profession year on year. Look at that 94% there from Opsis Muri. We can influence patients from cradle to grave. So I think we can have a massive impact on patient choices, public awareness. So I guess my call to you is raise your education and awareness and share that with your patients far and wide. Last plug, please join our nursing network. We can learn even more and get even more resources, case studies, topics, whatever. Please join us. The click and links there. I'll pop it in the chat in a moment. And finally, I love a quote. Please forgive me, everyone, those that know me. Alone we can do so little, but together we can do so much. It's about collaboration, not competition. We can see radical and rapid change if we all work together. Thank you.